Welcome, doctors, to today's program. What I want to talk about today is the AMA Guides to Permanent Impairment. What are the AMA Guides to Permanent Impairment? Well, first of all, what's impairment? Well, impairment is a loss of use of, or derangement of any body part, organ, or organ system. So a loss would be if I lost my arm. Obviously, if I got an amputation, I lost something. If I lost the use of something, if I cut the nerve to my arm and I can't use it, I lost the use of something. A derangement is a derangement. And so any body part derangement, derangements usually occur due to damage, due to injury. So it's a derangement of any body part, organ, or organ system. So it could be called the AMA Guide to Body Derangement or Body Damage or Body Injuries. It could be called the AMA Guides to Permanent Injury, but instead it's called the AMA Guides to Permanent Impairment. There are a number of editions, 3rd, 4th, 5th, 6th editions. They're very easy to use, extremely easy to use. But what are they? Well, they're the most consensus-driven way for a doctor to take a look at any injury and report the effect that the injury has on the person's activities of daily living. That's what an impairment guide is. So in an impairment guide, they have a thing called whole body impairment percentages. That means that if I lost my arm, the AMA Guides consensus document where doctors agree that this is going to negatively affect me in this amount of my daily activities. So it takes the injury, it says consensus-wise we all agree this is what the injury is, and then it says consensus-wise this is what we all agree the injury does to the person. So it's the only way, it's the only guideline that there is really in the world for determining if a condition is permanent or not. That's why they're called the Permanent Impairment Guides. So it's a way to determine if the person has a condition that causes a permanent problem for the patient. In other words, it changes their life. That's why they're important. Now, they're really important in injury work, because in injury work, there's a number of questions that are being asked. One, what are the injuries, and are the injuries permanent? Well, a doctor can give his opinion and say, yes, they're permanent, but that's like a doctor saying, giving his opinion and saying, the person has a fractured leg, but there's no x-ray to verify it. What the guidelines do, or attempt to do, is to say, this is what all the doctors agree. All doctors agree in the AMA, for this AMA guideline, that if a person has this body damage, this is the result, or the negative result, it's going to have in the patient's life. So for treating doctors who are doing injury work, it's a must, right? Because you're interfaced in a medical legal situation. In that medical legal situation, in depositions or in trial, they're going to ask you, how did you arrive at the fact that the condition was permanent? Remember, in the AMA Guides, all derangements are in the AMA Guides. So for spinal derangements, it says, did you fracture something? Did you have ligament damage that causes excessive motion? Did you have ligament damage that causes a disc herniation? Those are the three key imaging things. Remember, when you injure a body part, you have to damage something, you have to derange something, and it says, hey, these key derangements to the spine, we've listed. And we've given guidance for providers all over the world on how to assess them and how to determine the effect that they have on your patient's long-term future. Now, there's a confusion oftentimes that occurs with the AMA Guides. The AMA Guides are impairment guides. They're body derangement guides. And they say, take any body derangement, and they say, what's the negative effect it's going to have on the person's activities of daily living outside of work? Now, if a person has an impairment that causes an inability to work or has reduced their ability to earn a living, that condition itself is called a disability. So disability is how an impairment affects a person's ability to earn a living. Straight impairment is how the condition affects the person's activities of daily living outside of work. So the AMA Guides are the most important injury provider guidelines. That's why SmartInjuryDoctors use them, because it makes it very easy, doctors, in depositions or trial. Everybody wants things that are objective. Employers want objective. Insurers want objective. Lawyers want objective. Patients want objective. Everybody in the market wants objective. Objective means can be easily verified. Anyone can look up and say, oh, do I have a spinal fracture? Yes, on page 3, whatever it is, this is what it says, the negative effect this is going to have on this person's life. Anyone can look it up. Anyone can look up in the AMA guidelines and see that you're citing them correctly and see that the consensus is being delivered correctly. So they're the easiest thing in the world to use. Injury providers definitely use them. And they use them because, again, it's the only way that you can determine if you have a permanent condition. And doctors, they are so easy to use. I mean, essentially, you're doing a permanent impairment evaluation on day 1 when you're doing an permanent impairment. Now, that's going to confuse a lot of doctors because doctors know that an impairment rating is done at the end of care. That's an impairment rating. Impairment determinations are what you're doing in your examination and in your x-ray procedures, your MRI procedures, your CAT scan procedures. You're looking for derangement in body parts. Those are impairments. Now, the effect that they have on the person is called an impairment rating, and that is done at maximum medical improvement, which is a state where the patient, you feel as a doctor, the patient's no longer going to recover anymore. And that's when you do an impairment rating. But doctors, every doctor in the injury market should be using the AMA Permanent Impairment Guides. And I hope this podcast has kind of shed a light on that. I look forward to delivering more programs to you in the future, and I thank you very much for your time.